Thank you. I've been invited by Anne to, I'm actually a researcher, let me put that first. I'm a doctor, clinical microbiologist and a researcher, and I've been invited to share with you something of the challenges to research access in the Sri Lankan context. Let me start off by sharing with you something about education in Sri Lanka. Essentially, education is free for all. So, from 5 to 13 years old, it's compulsory, and there are state schools, over 10,000 of them. The medium of instruction is primarily Sinhala, which is the majority race in Sri Lanka. They speak a language called Sinhalese, but we have a substantial Tamil speaking group, so we have education in Tamil as well. English is a second language, and English teaching starts around the age of 8 or 9 in year 3 or thereafter. Now, we have 15 state-funded universities, which are also free, but there are increasing number of private tertiary educational institutions because the state universities cannot accommodate all those who have completed their A-levels satisfactorily. Now, education is the Fulbright Sri Lanka brought to everyone's attention, and all of us who lived there knew that the levels of English fluency among our academic community and members of the public service have deteriorated considerably after we got our independence in 1948. This is mainly because in 1960s there was a very big push for nationalistic sort of tendencies or nationalistic priorities, and Sinhala became the official language. Now, one of the results of that is for about 3 decades we didn't have an interest in learning English. In fact, there was almost an antagonism to learning English, and the outcome of that now is that though English is coming back, we actually don't have teachers who are competent to teach English, and this is a real problem. When we look at health in Sri Lanka, because I come from the health fields, health is also universal and free at point of care. We do have a private sector medicine as well, but the majority of the population can access health free. We are very proud of our life expectancy, which actually is almost the same as UK, in spite of a long-standing civil war. We have very low maternal and infant mortality. We have high childhood immunization rates because we have a very good public health network, and immunization was carried out even during the war years in the war-affected areas. Now, we have allopathic or Western medicine as one of our major systems, but we also have indigenous medical systems, and these are available from the state sector as well as the private sector, and a lot of local people, Sri Lankan population, access the indigenous system. Now, WHO tells us, or told us in 2012, that we are in epidemiological transition, and they listed a whole number of infections we still have, but actually the first of those, malaria, we were declared malaria free last year, and that's a very good thing. Japanese encephalitis we hardly see now because we have an effective immunization program, but we see a lot of dengue. One of the things about this is that the non-communicable diseases which you see, like diabetes and cerebrovascular accidents and so on, continue to rise. Obviously, improvements to health and well-being depend upon the existence of a thriving research and knowledge sector. And in my own world of infectious diseases, I am very conscious of the need for research because we have very little accurate and reliable information on many commonly encountered infections. I mean, we have some data, but it's not really put together, and it's very difficult to gain data to use it for policy making decisions. Now, one of the drawbacks, it's not the only one, but one of the drawbacks is that access to international literature has been very difficult. When I went back from UK in 1989 to re-enter the medical world, I had no access to journals, and the internet was not available, and so I came back to do locums here, and if I came back to do a locum every 2 years, I would read all the literature of my specialty in those 2 years in a 1-month locum. I would just sit and read and read and read. It was as difficult as that. In 2012, relatively recently, a consortium of Sri Lankan academic libraries was created, and they put down in writing, and this is officially and in terms of in relation to the state, that we had very little access to print as well as e-journals. And so I was told by Dr. Pradeepa, who is the chief librarian at the University of Colombo, that all faculties, including every department, was asked to make a wish list. From the wish list of the journals that they would like to have, a master list was refined and sent to publishers. Publishers were shortlisted, and 3,000 journals were listed to be made available. She said in 2014 to 2016, they had 5 databases, but they were collating usage statistics because some of the databases were not being used. We have had improved internet access, obviously, from the time internet became available, and what they're trying to do through the work of the consortium is to improve, to access global networks in areas of interest of the researchers. We've also had an increase of open access journals, and we are very grateful to INESP for Sri Lankan journals online, in which there are about 67 journals now, and I'm chief editor of one of those journals, the Sri Lankan Journal of Infectious Diseases. Now, I actually went back to the University of Peradeniya. It's a lovely place if you'd like to visit it. It has several faculties extending from arts and science and agriculture. In the health fields, we have medicine and dental and allied health sciences, and of course, we have also veterinary science. We have 3 postgraduate institutes of science, agriculture, and humanities and social sciences based in the university. Now, I did a little survey of about 40 academics ranging from professors to research students to ask about their access to current journals and what challenges they face now in 2017. And I mean, as we all knew, subscribed journals to our library, the main library and each faculty library, was very limited. Staff and research students' use of these faculty libraries was also very variable. Their big problem was that their access to full papers in key journals, whether it's Nature or some of the medical journals, was very often inaccessible, and because there was substantial subscription cost not only to the person but also to the institution. Another problem that they all uniformly mentioned really was the connectivity. We have internet access, but it is not uniformly available. For instance, I'm now emeritus professor at the University of Peradeniya. I've been given a room, but my room doesn't have internet access. So I have to use my own personal internet access. There are times when it doesn't work. The week before I left for UK, the Faculty of Medicine didn't have any internet access for about 4 days. So these are all local problems. Internet internet is also quite slow. And another major problem that all mentioned is that it's only accessible during working hours and through the university server, which cannot be accessed from our homes. So we're very limited in our access. We do have open access journals which are available, but they're not necessarily available in all disciplines, I was told. One of the things that I noted was that most people had not heard of predatory journals and actually didn't know how to distinguish genuine journals from predatory journals, and this is actually obviously an increasing problem. Now, open access journals are free to read, but they're increasingly costly to publish in. I'll give you just 2 examples. One was a research student of mine who wrote up a paper and then sent it, and it went through the review process. It was accepted, and then she was told that she had to pay something. And so she informed us as supervisors, and the 2 supervisors, we said we'd draw the paper because we hadn't made any arrangements for payment of any. It must have been there in small print, but it had been completely missed. And so we told her to withdraw, but she was very reluctant, as obviously people would be when they've got a paper accepted, which is difficult enough. And so she decided that she will actually pay the subscription, whatever was asked, and it was 2/3 of her monthly income. And she is a single woman with 2 children, and that is not a good thing. So I will go back and give her some of the money, at least some of it. Another example I have is that with international collaborator, we submitted a paper to the Lancet Infectious Diseases. We were a bit ambitious, I must say, but it was a very good paper. And it got good review comments, but one of the comments was that what we had said was not of general interest to the readers of that particular journal. But if we had got it accepted, we would have had to pay $2,500. And obviously my collaborator would have paid it, I think, but it's a lot of money. As people who work in the Sri Lankan context, there are limited opportunities for publication, partly because we are working in a relatively unknown research environment, and unless we are working with collaborators overseas who are well known, it's quite difficult to get what we publish into the better known journals. Obviously, the level of research may be lower than accepted in the main journals of the discipline. Now, some ways in which individual researchers got their literature was through their institution where they had done their postgraduate training. One of my younger colleagues got her PhD from a university in Hong Kong, and she still continues to get her papers through that, and sometimes we get our papers through that as well. Then through friends and collaborators in universities abroad, many of us have collaborators, we have friends, and so when we need a paper, we write to them and they send us a paper. I've been told by the people I surveyed that there are websites which give access. I myself have never accessed them. These apparently move their, whatever your internet, that site from every 6 months or so, but you can get practically every paper you need apparently. I have never accessed it. We do access through ResearchGate and other similar programs, and very rarely as a direct request from an author, only one of the 40 had a personal subscription. What are the challenges that I have seen and experienced? One, as I've already mentioned, is this problem with English, with reading and comprehension, and I think this is something that we have to address, and I'm glad that through AuthorAid, INASP is also helping us a great deal with this. But the second is that we don't actually have what I would call a research culture. We don't have large or long-term research groups where youngsters coming in get their inputs from people just above them, 2 years in, 3 years in. So everything they get, they have to get from their supervisor, and supervisor access, as you know, can be very variable. And so this is also a problem which we have to attend to locally. There has been a lot of improvement in improving access in many ways. One is the consortium, positive trends in local funding for research, and a lot of our researchers are now collaborating with researchers in other countries, which obviously is a good thing. I'd just like to share with you one area of research that I've been involved in the last maybe 8 years or so. Melioidosis is a disease which you may not be aware of. If you look up Vietnamese time bomb on the internet, you will find out what it is. The American soldiers who were in the Vietnam War, they went back to the States, and 20, 30 years later, when they developed cirrhosis or diabetes or were compromised in some way, suddenly became very ill and died. That's why it was called the Vietnamese time bomb. It's an organism that lives just under the soil, and I always knew that we should be having it because our conditions are very similar to Vietnam, Cambodia, Thailand, where they have the disease. But through curiosity, through interaction with Tim Ingalls, who is in Perth, my collaborator, and through a very enthusiastic research student who is from the Colombo University, we have now established that it's endemic in Sri Lanka. During floods, you have an increase in sudden illness, which leads to death, which hitherto has probably been identified as leptospirosis wrongly, and patients have died, young people have died. So now we provide a diagnostic service nationally, and we have made clinicians, laboratory providers, and the public aware of the disease, and we are hoping that through this, there is a definite decrease in the number of deaths due to this disease. Obviously, we have to have initiatives of improving reading and writing skills, and one of the things I would like to suggest, which has been suggested earlier, is that we try and get short summaries of research articles in simple English, which can help young researchers to build their knowledge of the rapidly expanding literature and also make them more intentional about what they read. we do have to have writing workshops, mentoring and so on, but we also have to motivate people to write, because writing in a different language is a real problem for many, many of our young researchers. Author aid is, University of Peradeniya is the newest author aid embedding partner, and they are trying to develop this whole process of mentoring, trainer workshops and writing workshops. And as I go back to a one-day mentoring workshop on the 20th of July. And so from research to action is a long process. To get research going and then to move it to where it impacts on policy, improves improves lives, promotes well-being, is a very slow process, which we have to kind of have patience, we have to do new things, and we have to actually have, I would call, endurance, a very big necessity in a country like ours. We have many challenges, but there are also many people who encourage us, inspire us, collaborate us, and again, once again, I would like to thank INASP very much for all what they are doing to help the research world in this area. For myself, to contribute even in a very small way towards reducing the burden of disease and death caused by infections has been immensely satisfying in a career which has lasted now more than 40 years. Thank you very much.